Good morning, everyone. We're here at the beautiful Mary Center on Georgia Avenue, and today is a big day. So I wanted to join Dr. Nesbitt here as we welcome some of DC's first 5 to 11-year-olds who will be getting the COVID-19 vaccine. Last night, the pediatric COVID-19 vaccine was approved for children 5 to 11, as has been anticipated. This is a monumental moment. I understand that how many children become eligible? Like 46,000 DC children become eligible. So we know for parents, they're breathing a big sigh of relief, and we know everyone will want to know exactly how they can access the free and safe vaccine. There are going to be a few places across the city that are starting to vaccinate children today, and more will start in the next few days as they receive vaccine. We will also begin our pop-up sites, pop-up clinics in a few days earlier, and have sites open by this Friday. And all of this information will be available at coronavirus.dc.gov. And I've said it and I'll repeat it. What's most important for families to know that this vaccine is free and it is safe and it is coming to clinics, your doctor's offices in the days and weeks ahead. And so like the vaccine for people over 12, we know that the vaccine for children is also very effective. It is safe and it has been tested in trials, and it will lower the chance of children getting and spreading COVID-19. This is a critical step in getting our children's lives back to normal, helping to keep the classrooms open that we have opened, help kids participate in out-of-school activities and travel, and be safer for themselves, their families, and our entire community. And it is good that this is happening right before the holidays. We don't want a repeat of the last holiday season where a lot of people went to visit friends and families and get-togethers without the children being vaccinated because there was no vaccine available. This year, it will be different. So we're excited. It's game-changing. And now let me turn it over to Dr. Nesbitt, who can talk to some specifics about the DOH distribution and take some specific questions about the vaccine. Dr. Nesbitt.
Thank you, Madam Mayor. We are indeed excited for yet another monumental moment in our country's response to COVID-19, where we have another huge part of our population being eligible for vaccination. We all know that the COVID-19 vaccine is our best chance of ending this pandemic and moving on to the next phase of what will be the new normal for us. Similar to the other phases of our vaccine rollout in D.C., doctors' offices across the district, pharmacies, and other locations will have access to the COVID-19 vaccine made by Pfizer for 5 to 11-year-olds. More locations will become available as more vaccine becomes available. We have received will receive over 20,000 doses of vaccine in the first week, and more vaccine will become available over time. So we encourage parents who want to get their child vaccinated to do so. And to do so as soon as possible. You can feel free to call your doctor's office to find out if they have signed up to be a vaccinating location to get your child scheduled for an appointment. You can also visit coronavirus.dc.gov and vaccines.gov to find a vaccine location near you that will be offering vaccines to 5 to 11-year-olds. And we're going to host a series of pop-up locations around the community in close walking distance and easily accessible to families for our 5 to 11-year-olds to be vaccinated. It's the best thing for you to do to keep your child safe as we go into the holiday season. It's the best thing to do for your child and their community to keep them in school, to keep them having the benefits of in-person learning. And we're so excited to be able to be in this next phase of ending the pandemic. Thank you.
Thank you. Okay, questions? Yes, sir.
Can you tell everybody how many shots children need to get And is it the same dose that parents are getting? Can you kind of compare it to what parents and older people have been getting?
Sure. So the vaccine that's been approved for 5 to 11-year-olds is the Pfizer vaccine. It is for those who are interested in dosing. It is a lower dose of the vaccine in terms of micrograms of vaccine. So it is a lower dose. It's considered to be about a third of the adult dose. So we do not encourage people to get their child some vaccine that is different than what has been authorized or approved by the FDA for a specific age group. So 5 to 11-year-olds should get the vaccine that is approved for 5 to 11-year-olds. It is based on age. It is not based on weight. So we want people to get the vaccines that have been proven to be safe and effective by age group. The vaccine is still a 2-dose vaccine for that age group. So you'll get 2 doses of the vaccine given 21 days apart. And the child is considered to be fully vaccinated 2 weeks after they receive their second dose. Questions?
Do we see possible vaccine mandates happening at schools for kids? Do we think that could be a thing of the future?
We currently have, based on the level of risk for activity for student athletes, a mandate for student athletes to be fully vaccinated, and that mandate is in effect now.
To get vaccinated, do we see that happening for younger kids now that that vaccine mandate expanding?
We definitely are going to watch the situation evolve in the scientific community, and we want our parents, just like we did with our adults, to have time to make the decision to get the vaccine, emphasizing, however, that every day that they wait is a day that their children and their families and our community is less protected. So we want people to do that, but we also want our kids in school full time, and we've been able to have full-time in-person school in our public schools. We have a testing regime and a mask regime and other safety protocols in our schools that have kept our kids safe in school. So it is important that we emphasize all of those measures have kept kids in school and safe, and now the next one is the vaccine.
Also see that we have a booster shot now for adults. So do we see a booster shot needed for kids to get vaccinated later on?
Sure. So in a lot of the discussions that we've had in the public health and healthcare community over the last couple of weeks, we've had plenty of discussions about this. As you all know, boosters are currently only recommended for individuals over the age of 18, and we've had vaccines approved for persons over the age of 12. We are following discussions and deliberations by the FDA as they review data around the need to have additional protection or booster doses for people under the age of 18. Right now, there has been no definitive decision based on the review of available science for persons under the age of 18. And a lot of that is due to what we currently know about vaccine-induced immunity, and that you have protection for at least 6 months. And given the duration of time that we've been vaccinating persons under the age of 18, persons under the age of 12, not sufficient time has gone by for us to be able to say that we need to have booster doses at a certain time period for persons who are younger than the age of 18. We may have additional information in the next couple of weeks. The FDA is expected to continue to review the data and the science and make decisions related to boosters for people younger than 18.
Yes, sir.
Hi, Janae with Axios. I have 2 data questions. First, I'll ask, how many pediatric doses have arrived in D.C. so far, and how many doses has D.C. ordered that we're still waiting on?
Thank you for the question. So the process for ordering vaccine has evolved since we began ordering doses of vaccine back in December of 2020. We're grateful that that process has evolved. So now, as this process for ensuring that vaccine would be available in communities, as soon as the CDC director made a decision as to whether or not vaccine would be approved, we were granted the ability to order vaccine in what was called 3 pulses over a week ago. We were given the ability for what we call our state allocation or the jurisdiction allocation to order around 18,000 doses. The federal government has additional partnerships where they dedicate vaccine to certain provider types or provider groups that they believe can well serve certain groups. So federally qualified health centers have dedicated access to vaccines, as well as pharmacies through a federal retail partnership that brings additional doses into states. So we estimate that around 24,000 or so doses of vaccine were made available to be ordered by various entities in the District of Columbia. And those doses began arriving as early as yesterday, meaning some have arrived to Mary Center, and they will continue to arrive to various entities throughout the district throughout the week.
Okay, and one more. How's DC working to prevent sort of the theme we saw of well-resourced people getting lots of appointments early on? How do you equitably roll out the vaccine for kids this time?
So my hope would be that Axios and many others will tune in tomorrow, where I will spend probably an hour and a half reviewing the district's public health response that will provide tremendous amount of context to what it means to have an equitable approach to vaccine distribution. And that will address what have been some perspectives around equitable distribution of vaccine and equitable access that will take into account what the system was designed to do, as well as how people wanted to access the system. So my hope is that you all will tune in tomorrow for that council-hosted performance oversight hearing. In terms of how we are distributing the vaccine related to 5 to 11-year-olds, we have looked at where the district's children are in terms of the 46,000, estimated 46,000 DC youth who are between the ages of 5 to 11, what neighborhoods and wards they live in. We have also taken into account in terms of our pop-up clinics where the biggest need may be for those populations, and we have structured our program around that distribution of the population. We know that the largest proportion of the district's children live in wards 4, for children 5 to 11 lives in ward 4, 7, and 8. You also note that similar to the initial rollout, we have more vaccine product available now than we had in December of 2020, in January of 2020, in March of 2020, et cetera. These were all things we knew from a public health perspective that we communicated to the public, but the public still experienced as a frustration. So the need to have a rigorous vaccine appointment scheduling system does not exist now, whereas it did before. So rolling out a 5 to 11-year-old program does not require the same appointment-only program at rollout, where we are immediately able to, beginning as early as this Friday, offer walk-up opportunities for people throughout the city. So our ability to have a structured program that provides walk-up opportunities for people to have appointments available in evenings and weekends for families that can accommodate their schedules should allow itself to have an equitable program. That should be, for all of those who watch an equitable program, needs to be taken into consideration who wants to be vaccinated. Right? So when you have an equitable program, you can design a system, but people have to want to be vaccinated. People have to listen to facts and not myths when they make decisions about how to be vaccinated. And so when you look at race and ethnicity data, it's not always an access issue. It is a choice issue in terms of who is choosing to be vaccinated. The last thing I will say about it is that we're here at Mary Center today. Mary Center has a lot of work to do. Mary Center sees a lot of patients. It is a remarkable organization. Mary Center does not only vaccinate people. Mary Center takes care of pregnant women. Mary Center takes care of people who have chronic health conditions. And Mary Center, like many other healthcare organizations, is challenged to continue to have a workforce that, after having battled COVID-19, still is able to rise to the challenge and meet the everyday healthcare needs of our community. And so when you talk about getting an appointment for a vaccine, you're also talking about getting an appointment to manage your diabetes, to get your cancer screening, to get all of your healthcare needs met, which is why we're careful to make sure people know that there are opportunities out in the community, there are opportunities out in pharmacies, and a host of other places to be able to be vaccinated as well. So you may find a situation where you have a telehealth visit with Mary Center and you get to ask all of your questions of your healthcare provider about, should I get vaccinated? And you actually take the shot somewhere else. So we need to be creative about how we're utilizing our healthcare resources optimally and making sure that we get all of these shots that we actually have in our city into people's arms.
Did you get that?
Yeah, thank you.
Wow, that was a good answer, Dr. Nesbitt.
I've been waiting on
I
that.
know, I see. See how excited she is about this 5 to 11-year-olds. And I just couldn't emphasize that enough. I'm very confident in the planning that Dr. Nesbitt and her team have been undertaking for many months to get ready. But we need people to be listening to the science and to go and get the shot to really protect our kids and to protect our recovery from this virus. So anyone else who hasn't asked, and then I'll come back to you. Anybody else who hasn't asked?
Yeah, I just wanted to sort of return to what you were talking about, racial demographics in getting in the people who've gotten vaccinated. I was looking at the numbers, and for the 12 to 15 age group, the number of fully vaccinated children among black residents was literally half of the number among white residents. I know this is a hill you guys have been climbing for a while. How do you approach this next stage?
It's a hill that we're climbing as a community. So it's not just the government. And we know, and a reasonable person could surmise that the disparity would persist among children, younger children, if their parents haven't gotten the vaccine. So we continue to push on our adults, our healthcare workers, our school workers are required to be vaccinated in the district. We know a lot of our employers across the district, including the federal government, are requiring vaccination. And so we know more adults will also become fully vaccinated, and we hope that experience will encourage them to look very closely at vaccination for their children as well. Any other questions? Yes.
Can I ask an off-topic question?
You may.
Okay. The jail is what I'm interested in. You had the U.S. Marshal Service basically saying that they're pulling 400 prisoners out of the jail essentially because it's not fit for their prisoners. And then the question is it fit for D.C. prisoners? What's your reaction to what happened?
Well, I think, Sam, there's a lot that we need to find out. We got a preliminary report from the Marshal Service, and everything I saw in it is concerning. We operate the jail. It has to be a safe, sanitary, and humane facility that helps people rehabilitate and come back into the world. Every person there is going to come back either to a D.C. community or likely one nearby. And my commitment is making that happen. We have an older facility. We've been managing a congregate facility in a pandemic, which has also put some strains on our staffing. And so I have asked my deputy mayor to dig very deep into this report, look at our own independent Corrections Information Council report that also found some deficiencies. Deputy Mayor Geltart will have a team looking at the operations and conditions as well to see what we need to change. And as for the Marshal Service, they have from time to time moved inmates from different facilities. And our focus is, of course, making sure the inmates are safe and the staff is safe and people are being rehabilitated. But they also have to be close to court because they're awaiting trial. And they need that proximity. And we need the courts to understand that we are doing everything to make sure our aged facility is providing safe and humane conditions. We do have two sides of our jail, as we know, and we are able to use both sides. And so one thing that the team is looking at is to see if there are specific areas that we can depopulate and put in another area.
One thing, Mayor, that I noticed looking at the details of the report is that a lot of it doesn't involve facilities at all. It seems to be the attitude of staff, cutting water off to inmates so they can't flush toilets or cannot bathe. A lot of it seemed to be just the way they run things and, staff.
And I'm sure you can imagine that is troubling to me, but it also points to a concern that I have about a lot of our public officials who have been, or public employees who have been reporting to work in person throughout a pandemic. They're tired. They're stretched thin. They've had a lot of call-offs. They've had a lot of people not show up, or they've lived through quarantine. And so it is important, especially in the public safety area, that we are providing rest and relief to our staff. Now, that's no excuse for anybody breaking the rules or not acting in a way that is professional or respectful and treating our inmates in a way that protects their constitutional rights. There's no excuses for that. But we have to figure out a way to make sure we have rested staff. Yes.
Your reaction to Virginia?
Well, Mark, all I can say is this, and I congratulate the I guess he's the next governor of Virginia, and I think that's all been called and it'll be certified. And I've not had the opportunity to meet Mr. Youngkin, but I will extend a call to him. What's important is that we have a strong national capital region from our point of view as a neighbor to Virginia. We had that experience with Terry as governor, and it will be certainly my message to the incoming governor that we continue to have that positive relationship.
Ms. Mayor, have you decided if you will run for mayor again?
Listen, I have decided. I am going to tell you. I'm going to tell everybody all at the same time.
Back to the Virginia outcome. Metro funding, regional cooperation, things like that. How are they affected by having, two Republican governors now in the region? Does that change things at all? How does, Metro funding, for instance, be affected?
Well, I have certainly thought about us kind of being, or me being, the only Democrat chief executive in the region. And I think that we don't have any problem whatsoever from the center of the region promoting democratic values. We believe in them. We believe in certainly the values of that Washingtonians have sent me here to protect. And so we're going to take that seat in the center of the region to promote our democratic values.
How much of a blow is it for Democrats' vision? I mean, I was talking to Jerry Connolly, who said it's a significant setback for progressives in the region. Do you see it the same way? Do you think you can see eye to eye with, Youngkin on some issues, as you may have done with Barry Hogan, if so?
I really don't know anything about Mr. Youngkin, so I have to give him the benefit that he wants to do what's best for Virginia. And Northern Virginia is different than a lot of the state, and that is what impacts us in the district. You raised the issue of Metro funding. There are transportation issues. There is a climate agenda that's important for us to work on together as well, including the Chesapeake Bay, which the Virginia and Maryland governors and us have been very supportive of. So there is certainly a lot to do, including how do we continue to attract jobs to this region. Yes.
Hear from the moms here.
Absolutely. Angela, you want to start?
You can come.
Would you mind telling us your name and how we spell that so we get that correct? And then just telling us what thought went into having your child vaccinated today?
Sure. So my name is Angela, Angela. And this is my son. Oh, where he is. Richardson. Richardson. And to answer your question, my son is the only child, so during the pandemic, socialization was very hard for us because he's the only child and all of his friends were at home. So I'm vaccinated, and my son has been talking about getting vaccinated this entire time. So this opportunity means a lot to me and my family because it allows my son to be with his friends and to be with his family and, of course, to be an active member in his community. So I'm just grateful for the opportunity for him to get his first shot today.
Can you tell us how old he is?
His name is Carter, and he's Carter, and he's 5.5. He wants me to make sure I say half. He's 5.5.
He was a little reluctant at first to get the jab.
He was. He does pretty well with needles and shots, but I think because everyone was in the room, he had an audience. He was a little shy, but he was very brave, and he did it, and we're very proud of him.
Thank you very much.
Thank you.
There's a lot of reservations among young black people to get vaccinated. How do you plan to continue to be an advocate to get other parents and young parents to get other kids vaccinated?
So for me, I am a young black mother, and I think it's important for us to do what's right for our community because we have to be the change, right? If we want to see change, we have to do what's right, but we need to take the lead, and that's something that I want to do for not only for me, but for my community and for my son. We are proud Ward 7 residents, and we want to be able to have everyone east of the river know that this is important. If we want to be out and hang out with our friends and do those things, we need to get vaccinated so we can not only protect our family, but protect our community.
Thank you. Say what your name is and what school you go to.
My name is Gael, and my school name, well, the name that I go to my school is Creative Minds, and I think every parent should let their kids to get vaccinated, and every kid in the whole wide world should let every kid get vaccinated.
Thank you, sweetie. Okay, thank you, everybody. Thank you.